Hi there, everybody. My name is Dylan Van, and I'm the Vice Chairman of the Pinellas Youth Advisory Council. And I'm super excited today because we're going to have a mental health webinar. And it's kind of going to revolve around the LGBTQ plus community. It's really a community that is kind of underserved in our country, and it's somewhat in a community that's rights and that kind of thing are being developed. And it's kind of our intention with this webinar to kind of provide this community and to provide people who may be connected to this community with support and in a hand to help, kind of that kind of thing. Personally, I'm connected to this group. My grandmother is actually gay, so I have personal connection to this community, and I certainly see how in my personal life and in her life, I see how they are underserved and just things aren't necessarily fair for them. So we kind of wanted to break that stigma and kind of reach out to them in this webinar. So we're super excited to have Ashley Hancock from Metro Mental Health, Health Inclusive. And so basically we're gonna have a Q&A. We're gonna ask her some questions about kind of her perspective and her sense of expertise in this area. So go ahead and take it away. Thank you.
Thank you so much for having me. My name is Ashley, and I am a licensed mental health counselor. I am the behavioral health program manager for the St. Pete and Clearwater offices at Metro Inclusive Health. And I'm excited to be here today at Metro Inclusive Health. What do you guys want to know? What questions do you have?
I guess we can start off by saying how you knew you were interested in working with this community and speaking about their rights and an alliance with their mental health.
So I identify as part of the LGBTQ plus community, and the way I became a counselor is through my own experience. I've experienced depression and anxiety. I know I've gone through the coming out process myself. So I think it was just me identifying that there was, I had some stuff, and because of what I've been through, I maybe can help some other people. I also have a family history of addiction. So through working with that with my family, having family members with addiction, it's just provided a whole big background, and it's just something I kind of felt like I was called to do, if that makes sense.
Yeah, definitely.
Yeah.
I guess to further add on to that point is how did you, comfort yourself into realizing that position was for you, after you came out, or how did you feel that people were going to react towards yourself, and how did you cope with that personally?
You mean my own coming out experience?
Yeah.
Oh gosh. Let's see how to make this short. Let's see, I always knew that I was different, and I left the state. I went to a different state to go to undergraduate school because I was depressed, and I thought if I got away from my family, everything would be better. And it wasn't, because I had some depression issues I needed to deal with. And part of that, of course, was stemming from not being out. And so through my experience in undergraduate, I connected with a counselor, and she was so wonderful with me. And I try to think of her whenever I see clients, because she was so non-judgmental, and she just allowed me to be myself. And she even tells me I was really homophobic when I first started meeting with her, and then I ended up coming out. So that was really interesting, because I never thought of myself as being homophobic. But she helped me through the whole coming out process. So I came out in college. I was, I think I was 20 or 21. And I was really scared. My mom is super religious. And so I was worried that I was going to be disowned. My dad's not religious, but he is a little conservative sometimes. And so I really had no idea what to expect. I'd heard all these stories, you know, being gay is, you know, I'm 40, almost 45. So, you know, 25 years ago, it was totally different than it is now, I think. I think it wasn't cool then. You know what I mean? Like it wasn't, not that it's like cool, but it's not that it's,
like a common thing you would see, I guess.
It wasn't common. It's not something that I thought was an option for me with my upbringing, with my Christian upbringing, very conservative. And I actually wrote letters to both of my parents coming out to them that I worked on probably for months. And they both were like, you know, we love you for who you are. I actually couldn't have had a much better reaction. My mom still, you know, she doesn't brag about her gay daughter. You know, she doesn't go to PFLAG, and I don't even know that she knows what the rainbow symbol means, but it's okay. It's okay. Like, she loves me. And when I had a partner, she embraced my partner and our kids. But just having a counselor there with me to walk with me through that whole process was absolutely amazing. And I'm overjoyed that I get to help people through that same process. That's just one of many, many, many things that we address here, is the coming out process, bullying, that sort of thing. What else?
Does anyone have any questions in the chat that they want to ask?
Did you want me to pull up the questions you all had prepared earlier?
Oh, yeah.
I have one. So just kind of during the pandemic and during quarantine, specifically, how has the LGBTQ plus community been impacted, and specifically to them, and more so differently than other people? Or is there no difference? I'm just not sure.
You know, that's a really good question. I think that we are all impacted with what's going on right now. And I think that a big difference with the LGBTQ plus community is that, you know, a lot of us are at home, and, you know, we've had to stay at home in order to protect ourselves, and not all LGBTQ youth are embraced and accepted as who they are. And so the outlets that we have at Metro, for example, we've got Metro Youth Nights on Friday and Saturday nights. We have a youth group that meets weekly. I believe they're doing virtual meetings now, but it's, you know, it's different. It's taken a toll on everybody. We're really seeing it across the board, not just the LGBTQ plus folks. And you know, the times are so uncertain right now.
Mm-hmm. Yes. Yeah, so, we had a speaker last week discuss like how we had thought we were under so much control, and we never really were, but it was just something that we had thought we were. And so when we realized that's all taken away and it really wasn't in our hands, it can cause, you know, depression, anxiety, and that kind of thing. And that's just obviously for everybody. So that makes sense.
Yeah.
I guess that can take me up to my follow-up question with the whole COVID thing. How has that affected this specific community for their health, their well-being, and trying to accept themselves freely as a whole?
Oh my goodness. I think that it's really caused everyone to take a closer look at themselves. We've all been spending more time with ourselves And, you know, I think some people have a new appreciation for, you know, the whole after COVID thing where we can get together and, you know, be in big groups and hug each other and, you know, go sit at a restaurant and not even worry about all the people that are around us, you know, and I think that a lot of people are really just over it, to be honest. I mean, they really are. It's like, when is this going to be over? And, you know, the time of uncertainty it's unbelievable. And I think that this time can help us really focus on living in the moment and living in the present and just really enjoying everything that we have in front of us right now. Because it does seem like we're such a society and we're go, 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 go. You know, we're at work and, you know, we're at school and it's like, okay, what am I going to do next? And, you know, I'm going to go out with my friends, I'm going to go to the movies, I'm going to go get my hair done, you know, and it's just like, go, 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 what's next, what's next, what's next? And now we're all like slowed down and it's like, okay, now I've got to sit with myself. So I think it's actually caused a lot of folks to say, you know what, life's too short. I'm going to be me. I'm going to be who I am. And there's no better time than the present. At the same time, there are some real safety concerns, you know, with kids or, you know, with youth, with, you know, even if you have a roommate, you know, if you're staying with a roommate, that maybe it's not safe to come out, you know, a safe environment.
What advice would you, I guess, provide, like if you had a client on a Zoom meeting and they asked you, how am I supposed to, you know, come out to my parents and show them who I am, but at the same time stay, you know, like protected? So, because I know it can be a hard thing, because I know some people in my family, and that was one of their problems. It's that they've felt like they've needed to come out for years and years, but they do it when they're like in college and they've had those thoughts ever since like middle school. So what advice would you give to someone to mentally prepare and just remind them that it's their life kind of way, not anyone else controlling them?
Wow. I think for, you know, some people say, oh, it's a choice, you know, to be gay or whatever, to be LGBTQ plus. In my opinion, it's, in my professional and my personal opinion, it's a choice to be who you are. It's a choice to accept who you are. So I would say one of the things that we offer here at Metro for ages 20 and under is we offer free counseling if you don't have access to insurance or you don't have a means to pay. So just give us a call and we'll set you up a therapy appointment. And it certainly is a great idea to have a plan for coming out. You know, it depends. I mean, some people are just like, you know, hey mom, I'm gay, and some people it takes years and years and years. So I definitely think, you know, Metro is here where we've got counseling here, we've got professional counselors, licensed counselors, and it's free to 20 and under. So if anyone is struggling with this, please call us, sit down and talk to a counselor. That's what we're here for. You don't have to go through it alone. I think that's the main thing is that you're not alone, and there is a whole community of people. There are so many people that are going through the same thing that you are, and we have so many programs, youth programs, support. And I think I see that's what folks a lot of times feel like, oh my gosh, I'm the only one on the planet feeling this way. How am I going to get through this? What am I going to do? how do I tell my family, you know, and it's a lot to process. It's a lot to process. And so that's what we're here for. And I think, you know, I think having social support is key. You know, having people that you trust, that, you know, love you unconditionally, that accept you for who you are, that are non-judgmental of you. And that's the kind of community that we try to promote here at Metro.
Okay, yeah.
I wanted to share in the chat, we have a question that says, have members of the LGBTQIA+ community faced issues related to medical care, both with COVID and just in general? And do we see trans and gay people not being taken seriously in the eyes of medical providers?
Yeah. Yes, unfortunately. All right, so there's a few questions here. Have members of the LGBTQIA+ community face issues as it relates to medical care? Yes. We especially see trans men a lot of times, you know, won't go and get their annual exams like they need to. A lot of times folks are discriminated against by medical providers. I don't know if you guys are aware, but we have medical providers here at Metro. We have primary care, we have trans care, we have doctors that can prescribe hormone replacement therapy. And so the idea is that you can come here and not have to encounter, you know, discrimination based on your gender identity, your sexual orientation, your gender expression. I think, you know, even personally, you know, like, you know, when I go to the doctor and they're like, well, are you on birth control? And I'm like, no. Like, and then I have to go and explain that. It's like, it's none of your business. But, you know, it's like, it's their job to ask those things. You know, what are you doing to protect yourself? What are you doing to take care of yourself? I think that it's really important for folks to advocate, you know, especially if, you know, if you're trans or non-binary, you know, this is my name, this is my pronouns, these are my pronouns, and that's it. And then, you know, obviously you can't force people to call you, you know, something, or, but you can be firm and say, look, this is who I am. This is my name. This is my pronouns. And I expect respect. I'm going to give you respect. I hope that you will respect me as well. And sometimes just that basic thing can be a barrier because medical providers won't understand it. So we're really, really happy to be able to have medical providers here. We've got several doctors and physician assistants for primary care, for HIV care, for HIT care, and hopefully no one will experience any kind of discrimination or not being taken seriously because of their sexual orientation or their gender identity.
So on an international standpoint, so not just in the United States, but in countries elsewhere, so what are the legal and cultural barriers that LGBTQ plus community faces? And it's like, and you can mention a few different countries if you'd like.
Oh gosh. Well, I mean, gay marriage isn't recognized everywhere.
Yeah,
you know?
certainly.
I mean, you know, a lot of times the LGBTQ plus community, we choose our family, and you know, our family may not be the family that we were born into, and that's not always recognized legally. You know, if you've got a loved one in the hospital or something. Let's see, even like with adoption, not all, not just anyone, you know, if you're part of a gay couple or a trans couple, I mean, you can't just it depends on the state, I guess. It's not a federal thing. But there's adoption issues. I know even in the United States, we just passed the workplace discrimination policy, but it used to be that you could be fired for your sexual orientation or your gender identity. Just no reason, just gonna let you go. Basic things like refusing you service because of how you look or how you're acting, using bathrooms. Some folks don't even feel comfortable using bathrooms. You know, I mean, even in their schools, you know, I hear about some folks saying, I don't feel comfortable going to the bathroom in my school because I'm going to be bullied because I don't identify with the gender I was assigned at birth. People see me this way, you know. There's so many different things. What else do you guys think? What else are you seeing? What do you think would be some barriers?
Well, I think certainly, especially in high school and even in just all social life as a teen, I think there's a lot of kids have preconceived notions of who and what the LGBTQ community is, and really kind of, I mean, there's probably a false notion of that they want attention and that's the only reason they're doing this and da 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 and that kind of thing, and that it's not really necessarily who they are, it's just really who they want to be or that kind of thing. And so there's that notion, I feel like, and obviously that's not with everybody, and it's not necessarily a general notion, but that notion definitely exists throughout high schools and that kind of thing.
Yeah.
Yeah, another one can be like going into stores. Like if you don't associate yourself with the certain gender that you were born with, and like you walk into a different store, or like a certain store made for women and you're a male, and you have everyone just like staring at you like, why are you going in there? What are you buying for yourself like that? You're not supposed to be in there. But at the same time, we're like called to be our unique selves, and it's not right to judge others like when we have our own problems too. So
yeah, exactly.
And I definitely do think that there is almost an inequality throughout the LGBTQ community, because I feel like in recent times, I feel like the lesbian, gay community and bi community has been more accepted than the trans community. I think I definitely see that. I think that a lot of people are becoming more accepting of gay and lesbian people, but are still rather reserved when it comes to trans people.
Yeah. And we're all people.
Exactly. Yeah.
We're all just regular people.
Yeah, and like some people, like it's just the craziest thing. Some people will just be like kind of acting in a way as like, I'm a better person than you. It's like we're the same thing.
Yeah, exactly.
Kind of on that note, I wanted to get to the questions on here because that kind of goes along with it. So how can somebody, or do you have any advice for like a young person trying to advocate for more inclusive policies or just people in their lives?
I'm sorry, can you repeat that?
I guess the question says, in what ways can a young person effectively advocate for inclusion concerning LGBTQ plus matters? I think yeah.
I think be an ally. Be an ally. Let people know that you may not be LGBTQ plus or identify as part of that community, but that you're an ally. I think it's really, really important not to make assumptions. Don't assume that someone has a boyfriend or a girlfriend, or that someone is a boy or a girl just based on their gender expression, because there are so many non-binary folks out there. I think, what do you guys think? What are some other ways that you folks can advocate for inclusion with LGBTQ plus?
Well, I think that socially engaging with them is certainly something that isn't necessarily done as much. I think they may be accepted, but they're not necessarily socially engaged with. And it's almost like it's a social reform kind of thing that might need to occur. And it's almost the same as in the Black rights community right now, is where the legislation is there's decent legislation. Obviously there needs to be change, but really a social change is definitely going to be needed, and a societal and systematic change.
Yeah, and I think an important thing for us as individuals and the youth speaking out is to remind people that there's no hierarchy between who you are and what you do and what you want to be, because it's a confusing situation for those people, and when others confuse them more with their words, their thoughts, that can hurt them and then cause more confusion as well. So it's important to make people alert to how those people in that specific community, whether they're lesbian, gay, anything of that sort, and just where they stand as human beings.
Mm-hmm. Yeah. I mean, what do you all do if you see someone being bullied? If you see someone asking, well, are you a boy or a girl? Or, you know, do you like girls? Do you like boys? I mean, if you see someone being picked on, what do you do? Do you do anything?
I mean, I personally would like stand up for the person, but that's just the kind of person I am.
Yeah, I mean, Go ahead.
Oh, okay. And certainly and sometimes it's not necessarily that it's like a physical bully or something like that. Sometimes it's not even a direct like verbal bully, but it's something that you can kind of see as a chip away at them every day. There's something maybe that hits them in a certain way. And so I feel like even just like pulling them away someday, like after class, and be like, hey, if you want to talk, or I support you, or whatever, something like that. I think that what you said was interesting. And even though other kids disagreed with you, I thought it was interesting. And even if I disagreed with you, so even if it doesn't even matter if it's something completely not related to the community, to the LGBTQ community, it can still kind of come off of they disagree with me because I'm gay,
Right.
or something like that. And so even if like I disagree with you about something, and I can pull you across after class and be like, hey, I support your opinion, even if we have contradicting opinions.
Yeah, and then Dylan, I'm going to piggyback off of that. That goes back to like families too, and how they can subliminally offset that like click in the mind. Like I know someone a close family friend, he's like 12 years old, and he just walked out one day and his brother was like, oh, you look gay in that outfit, go change. It's like, what? It's like you can't tell that to someone who could be struggling or dealing with that, and that can affect them in a certain way, in a negative way.
Mm-hmm. Yeah.
Jupiter shared something in the chat, and I think he wanted to unmute and share as well.
Please.
Yeah. Can you guys hear me?
Yes.
Okay, great. On bullying, I think it's really important to have certain phrases in your vocabulary to just go ahead and interrupt that phobia as soon as you see it, because while it is very important to make sure that you're showing support for the LGBT community, I think it's also important that when we see bullying to step in and put our foot down as it happens, to make sure that it's not a behavior that is, I'm not sure how to say it. It's not a behavior that's
Socially accepted.
Yeah. So when you hear someone saying phrases like that makes you look gay, interrupting and saying things like that makes me uncomfortable, or we don't say things like that, or there are interrupters that you can use to make sure that the person who is possibly using phobic language to understand that what they are doing is discriminatory and isn't okay. So, because sometimes when you tell the person, hey, that's not all right, they will backtrack and reevaluate what they're saying. So it's important to also make sure that these phobic people that are in our lives are given the opportunities to take those steps back and become possibly allies and to become better.
Thank you. That's a really good point.
Thank you.
I mean, what advice would you give to the youth who are experiencing, I guess, in a sense, I mean, it is bullying, like through their families, when they try to come out hinting certain things, but they're not accepted?
How to come out when you're not accepted by the family is that,
Yeah.
yeah. I hesitate to say, because I wouldn't want someone to come out if it's not physically and emotionally safe. I think every person is different, and I mean, you certainly could drop hints. What do you guys think? What do you all think?
I mean, I think that there's definitely, it's very case by case. It's not necessarily, I mean, because you definitely have to ensure that it's safe, because well, your personal safety needs to kind of, I mean, that should be your top priority. Even if it means that you have to suppress your inner feelings and that kind of thing, just for until you can move out of the house, and that kind of thing. So it's not just to suppress your inner feelings, but also to know to find a way to exit that unsafe community and environment, so then you can actually express yourself.
Mm-hmm. Yeah, I think sometimes, there's, there'll be one parent that, when I have a youth client, they'll feel like, well, I think that one of my parents are going to be accepting, but I'm not sure about the other one. Let's bring that parent into a session and talk to them. Let's see what's going on. That's also something that, as counselors, we can help facilitate, is family counseling. How am I going to come out to my parents? What's that going to look like? What's plan A, B, and C? Can you help? And so what we can do is help facilitate a conversation, because a lot of times what I see is it's more I don't understand, as opposed to I don't approve of you, or I don't accept you. It's more like, I don't understand, help me understand. And that's something that a counselor can help you through. I can't hardly see any of you. I wish I saw you. I'd like to see your faces and how you're reacting and whatnot. What do you guys have to say? What do you all have to say?
I think most everyone on here has video, your things sent in to me, so y'all can you can put your videos on and unmute yourselves whenever you want.
Nice.
Yeah, I'm sorry. My video and my mic just keep acting up, so I need to shut it off every few seconds and then turn it back on.
Hey, there all of you are. I want to hear your stories. Tell me, what do you think?
I mean, I think it's important for people to stand up for themselves, but at the same time, they need to understand everyone else's thoughts and their perspectives, not only their own.
Exactly.
And I definitely think that, I mean, in my personal life, I mean, I'm just not necessarily educated enough about about the community. And I mean, obviously I know what a majority of it is, but I mean, obviously, like, just as you were saying with like parents and that kind of thing, like, help me understand, help me to kind of grasp what everything is, because not everything, because a lot of people aren't necessarily aware of everything and how people want to express themselves and why.
And I definitely think it's important to remember that, like, it's definitely good to reach out and ask a transgender or gay person for their opinions, what resources that they have, their views on certain social climate change things that are happening in the world. But also remember that things like Google, like, you have search engines, you do have places that you can go to do your own research. For transgender and gay people, we have a lot of discussions with allies that can sometimes, for certain individuals, take a lot out of us. And it can be a lot of reliving things. It can be a lot of pulling up topics that really hurt. And that's not to the fault of the ally. It's just something that you need to keep in mind. Because while I can say that 99% of the time we do want to engage you in those conversations because we want to give you that information, make sure that it's kind of like a 50-50 split. Half of the time, try to go to Google to look for your questions, go onto a search engine to try and find information. But if you just cannot find a book or an online article or a person talking on social media about the topic you want information on, then move on to a member of the community, just because it can be very taxing.
Very, very, very good point. And I think that's where we need to stand up and say, you know what, I'd love to have this conversation with you, but can we do it tomorrow?
Yes.
Or can we do it next week? Because it can be very draining. It really, really can. That's a really good point.
Does anyone have any more? Oh, sorry. Go ahead, Dylan.
Sorry. So I had a question, kind of just kind of for personally and kind of also objectively, like, so how does, like, somebody who is gay or who is in the LGBTQ community, how can they engage religiously, even if they still want to engage religiously? Just because, I mean, in my personal experience, my grandmother, she's still very religious. And how she still goes to church, and she goes to a church where she's accepted and where people are very, you know, kind and accepting of her and her, and that kind of thing. And I've also known to, like, kind of grown, my family has become incredibly more accepting just in knowing her and her partner, who is my grandmother. I consider her my grandmother. And so just how can they engage religiously when they would like to?
That's a really great question. I think there are so many churches out there that are accepting of different gender identities and sexual orientations. There's Unity. There's, I think it's the UU Church, Universalist Units. I can't think of what it's called. Of course, there's King of Peace, which is right next to Metro in St. Pete. There's a lot of different churches out there that are accepting and embrace the LGBTQ plus community. On the other hand, there are some that are not our allies and they're not our supporters. And personally, I don't step foot in those places. You know, and a lot of times the churches that are accepting, you know, they'll have like a rainbow sticker, or they'll have, you know, a trans flag sticker, or, you know, like there'll be little indications. Sometimes I think at Unity campus, the main pastor or reverend is a lesbian. She's an out lesbian. So there are, and then of course there's the whole discussion where there's a difference between religion and spirituality, but I think you mean like going to church and what.
Yeah. Mm-hmm.
I would encourage, you know, there's a book that I read called We Were Baptized Too. I read that when I was coming out. and it basically, I mean, people interpret scriptures different ways. And I personally go where I'm included, where I'm embraced. And there are so many places that will embrace you. And go and talk to a lot of the pastors or reverends. You know, they have counseling to help you through that. You know, through barriers, through perceived barriers, even. Have any of you had any experience like that? Had any good or not good experiences?
With what exactly in relation to religion?
Yeah.
I was, I kind of stepped off of my church's choir because of stuff like that. Oh, I can hear my dogs going off in the next room. I experienced not personally directed at me, but the church that I was attending definitely wasn't accepting. And that was while I was a child, basically through my entire childhood, which then, you know, it goes on to shape your views on the topic. So I definitely have personal experience with trying to go to a church, and the people there talk about individuals as if they are not in the room, which can be very hard. Usually you walk into a room, at least these days now I understand, I walk into a room where people will just automatically suspect you as a cis heterosexual person. And you are, especially in religious settings, you are left to kind of fend for yourself almost. When you're in a generic church, you have to walk in and immediately headbutt into the conversation as, you know, I am transgender, I need you to respect these name and pronouns. And if they don't, then you have to step back and go somewhere else, which that in and of itself, I think, explains the injustices left there. It can just be very difficult to be religious and part of the LGBT community, and it might take any amount of time to go through that hurt of the, you know, being rejected from your own community in order to get to a place where you feel comfortable. It can be very hard.
I personally haven't experienced or witnessed any of the non-accepting churches, but what do they do in the sense of that it's not accepting? Like, I know you mentioned that they'll speak as if you're not there, but do they like do anything that's obviously like discriminating against you guys in their teachings? Or
yeah, so that homophobia and transphobia can present itself in multiple ways. It can be through just the phobic language itself, as in using their teachings to, you know, and everyone, I don't want to get into too much of the specifics of religion as I'm not a religious person myself. The experience I went through is using teachings in their religion to discriminate towards other people blatantly in their church. So what they did is, through me having a partner in their church, was just deeply frowned upon. They never, and that's another thing. It's not as if they were trying to say that we will be removing you from this church if you do not abide by our rulings. It is simply being, you know, the outcast of the group, not being included in scheduling. It's like, as when I was in choir, suddenly I just stopped getting emails about when our next choir sessions would be, about when concerts were. It's the, oh, well, we found out this information about you. We found out, you know, you've expressed who you are, and we're not really sure if we like that, so we're going to distance ourselves. And it's, in my experience, it was being the outcast and the exclusion.
okay, because I was unfamiliar in that sense of how their form would be, but I guess now I understand more about it.
Yeah.
Are there any other, I guess, well, I mean, there are multiple, but any other aspects where there's subliminal discrimination? I know, like, within stores, people can just stare you down and mistreat you, or like, I've seen like someone not take a coupon because I worked at Target because they were of that community, and it was just like, it's a coupon to save money. What does that have to do with their sexuality at all?
I think it's just appropriate to be kind to everyone. You know, especially if you see someone with their head down. You know, you see someone that's got low self-esteem. Sometimes people, you know, you never know what someone else is going through. And I just think, you know, I don't think that you can go wrong being kind. Just smile at somebody. Just say hello. How are you? It's good to see you. You know, compliment them. A little bit goes a long way.
And I think for like companies and corporations, it's not always what they're doing, it's what they're not doing. Like the reason I love to shop at Hot Topic, even if their employees are cis, they have their pronoun pins on their badges.
Mm-hmm.
When they talk to you as a customer, they use gender neutral pronouns. It's just as simple as that. It's like I was in a Hot Topic the other day, and you know, it was just as simple, oh, I really like your nails, but the other cashier couldn't quite hear what was being said, and when they referred to me, they said, oh, they're nails. It's stuff like that. And I think that really does tie into being an ally, because it's kind of like what the BLM movement has mentioned many, many times. It's not always enough to just not be homophobic. It's to be actively anti-homophobic. It's to be actively anti-transphobic, to put your foot down and say, well, sure, you say that you support gay and transgender people, but then why are you not doing these things in your stores? You know,
Mm-hmm. Well
just
said.
being, yeah.
Does anyone have any further questions they would like to ask from the chat, from the Google Doc? I saw Ashley posted that in the comments.
I wanted to, one thing, so someone that may be struggling with their mental health, so other than, so you all have free mental health services for youth. And are there any other resources that they can do additional to that you would recommend, or places they can go read, or anything like that you would recommend somebody to do that is struggling?
Yes. Have you all heard of the Trevor Project?
Yes.
Yeah, that's a great website. Great. It's a very informative website. They have a hotline, a crisis hotline that you can call. The website is trevorproject.org. There's the National Alliance on Mental Illness. It's NAMI.org. National Alliance of Mental Illness, NAMI.org. The National Suicide Prevention Lifeline is an incredible resource, 24/7. And that number is 800-273-8255. I personally put these phone numbers in my cell phone. Not because I think that I'm gonna need them, but in case someone else needs them, I have them handy. I don't have to sit and look. I got tired of looking them up all the time, so I just put them in my phone. And I do that with my clients. You know, if you're having suicidal thoughts, have that National Suicide Prevention Lifeline phone number in your phone so that you can call them. Call 911. There's 211 also, that is a good resource as well. SAMHSA.gov, SAMHSA, it's the Substance Abuse Mental Health I forget what it stands for. It's samhsa.gov. That's a really, really good resource. Drugabuse.gov is a really, really good resource as well. You know, that's something that I didn't even touch on today is you know, so many youth turn to drugs and alcohol as ways to cope when they're not accepted and because they feel different. And, you know, we can develop a lot of bad habits from doing that. So reach out and get some help. I actually have a client at 4 o'clock. So is it okay if I give my email and my phone number?
Yes, please. Thank you.
To folks? Well, first of all, our website is metrotampabay.org, METRO tampabay.org. And my name's Ashley Hancock. Again, I'm the Behavioral Health Program Manager. And the phone number is 727-321-3854. And my direct extension is 1236, 1236.
And is that your number directly, or can they call that number for the counseling as well?
So that phone number is the main St. Pete phone number. If you ask for me or give that extension, it'll go directly to me. But if you just want to call and schedule a behavioral health appointment, you can just ask for scheduling, you know. If you want to make an appointment for, you know, medical or something like that, we also do free HIV testing and Hep C testing.
So that would also be the same number to contact for like HRT?
Yes.
Okay. Thank you.
Yes.
Thank you so much. I'd let you get off to your client. We super appreciate everything.
Yes,
Thank you so much.
Yeah, thank you so much.
Oh, thank you for having this. And please feel free to reach out. You're not alone. Let folks know that they're not alone. You know, we're here for you. When I was your age, I didn't have something like this. And I wish that I did. So I'm so honored to be a part of it now. So I'm so proud of you all for being who you are, exactly who you are. And please reach out if you need anything, okay?
Yeah, thank you very much.
Thank you.
Thank you.
Alrighty.